Welcome back to News 3 today at 11. Colorectal cancer is the second leading cause of cancer deaths in both men and women in the United States. According to cancer.org, it's estimated that colon cancer will cause nearly 53,000 deaths this year in this country. That's why early detection through screening is crucial. Dr. Jamal Lawrence is a double board certified family medicine and lifestyle medicine physician and the founder and CEO of Harvest Health MD. He joins us now with more. Thank you for returning, and especially with such a critical topic that we're talking about today, and that's colon cancer, which I had no idea that so many men and women are affected by this disease, particularly women.
Absolutely. Thank you for having me, Ms. Cosby. Yeah, so colon cancer is one of the most commonly diagnosed cancers.
Yes.
It ravages communities, and disparately, you see it, in terms of sexes. 34% of men don't get access to it. Women are a little bit more likely to come into the doctor, but we really need to emphasize the point of getting screening. People a lot of the time do not have access to adequate screening, or sometimes they don't even know. And so that's a conversation we always want to reinforce, that patients go into their primary care doctor and they ask for screening, that they are knowledgeable about what needs to happen at certain ages to make sure that we catch cancer early. And
speaking of ages, the age to get that screening has been lowered.
Absolutely. Most people are pretty familiar with colorectal cancer screening beginning at age 50, but the United States Preventive Services Task Force recently, about 4 years ago or so, lowered the cancer age to 45 to improve early detection. And so what we were finding was that people under the age of 50, there was an increase in cancer incidence, about 10%. And so we're really trying to catch cancer a little bit more early so that we can improve survival. The earlier you catch cancer detection, you improve 5-year survival by 90%.
Because we all know that once you start developing symptoms, by that time, that it has progressed.
Absolutely, absolutely. You always want to make a distinction between screening and diagnostics. So if you are having any type of symptoms, blood in your stool, anything like that, weight loss, those are things where it's a diagnostic and you need to go to see a physician immediately. For screening, it's asymptomatic, meaning you feel fine, there is nothing at all wrong with you. That's when we want to go and catch it, because oftentimes when you are experiencing symptoms, it's a little too late.
Let's talk about screenings, because there are a couple of ways that you can get screened. Going to your physician, but also there's a kit that can be mailed to you at home. Which, do you suggest that method?
Yeah, absolutely. And so, when you look at screening, there's actually about 5 to 6 different ways that people can get screened. Oftentimes people automatically assume if it's, no colonoscopy, or because it's a pretty invasive exam. If they don't want to do that, they can't get screened. But there are a multitude of ways to get screening. Colonoscopy offers you the longest time in between screening, but there are also yearly screenings with the FIT test, as well as a combined DNA and stool test. And those tests can be done every 1 to 3 years, depending on the test. And you pretty much get about the same when it comes to the effectiveness of the test. The importance, though, is that we stress consistency. So you don't just get screened once and then disappear. It's over the long term, consistently screening, where we see the mortality go down.
All right, now we're running out of time. We had about a minute left, but I do want to touch on this because you talked about disparities a little earlier. And I was reading that according to cancertherapyadvisor.com, about 8% of new cancer diagnoses among African American men and women will translate into more than 10,000 men and women developing the disease. Why is that?
So one of the things, there are a couple of reasons for that, but one of the things that we're willing to stress is access to screening. A lot of times African Americans are not getting access to screening. They're not having those conversations with their doctor, or they're waiting too late to go in and have those conversations, and by the time that comes and you have symptoms, it's a little bit more of an issue. But then we also want to stress the preventative things that you can do at home, right? And so that's exercising, which reduces your risk of cancer. It's also eating right and changing your gut microbiome so that you can have a healthier outtake, as well as lowering your risk of cancer, of smoking, as well as drinking.
All right, Dr. Lawrence, thank you so much for joining us today. Now, if someone would like to find out more information, how can they contact you?
they can contact me at info@harvesthealthmd.com or visit my website at www.harvesthealthmd.com.
All right, their phone number is right there on the screen, 912-421-9143. And also, to find out more information, go to our website at wsav.com. Thank you, Dr. Lawrence, for joining us today. We appreciate the information so much.
Thank you so much for having me.
All right.